Welcome to this talk on chronic kidney disease. What we will be looking at is what are the options for those who are facing this issue, and also what are the lifestyle corrections and how clinically supported lifestyle correction can help. To begin with, the first question is what is chronic kidney disease?
Basically, chronic means slowly progressive. Medically, we are generally classifying diseases acute and chronic. Acute kidney failure can come, and also the chronic. Chronic means it is developing in an hour or a time period. Acute means within 1 or 2 or 3 months the kidney goes into failure, and the person may need dialysis. But in chronic renal failure, it is gradually, it will take usually years to develop. As usual, common is with diabetes, nephropathy, hypertensive nephropathy, autoimmune nephropathy like IgA nephropathy. This all comes under the chronic renal failure, that is CKD.
Actually, when we talk about this chronic kidney disease, almost always it is associated with other lifestyle diseases like diabetes or hypertension or high cholesterol and cardiovascular problems and so on. What exactly is this connection between chronic kidney disease and say for instance diabetes?
See, diabetes, the problem we all know. Generally, we are thinking it is the problem is with the glucose, high glucose. What happens when the high glucose is high? It will damage the blood vessels. See, we are checking the sugar in the blood, but even when the blood is glucose is high in the blood, it is oozing out from the blood vessels and spreading to giving to all the cells in the body. So everywhere all the damage is happening because of the high glucose level. The damage is happening all over the body, especially the blood vessels through which the blood is flowing. So that is the reason actually. For the kidney, the blood vessels in the kidney, the filter unit of the kidney is called nephrons, and it said that there is a glomerule, that is a bunch of small blood vessels actually. They are getting damaged. That is the reason the kidney after a time period, because of the damage and the blood vessels, kidney fails. The same thing happens for the eyes also. Diabetic retinopathy and diabetic neuropathy. Everywhere, even the nerves is having supplied with the small blood vessels for their energy needs and the nutritional needs. So when they are getting damaged, when the blood vessels of the nerves is getting damaged, you get neuropathy. When the kidney is damaged, nephropathy. Eyes is damaged, retinopathy. So we call it in different names. That's all.
Actually, when we are talking about this chronic kidney disease, one of the major issues that are heard about is with respect to hypertension. It is said that hypertension can cause chronic kidney disease can cause hypertension. What is the current status about that?
Hypertension, it's a chronic renal problems. There is hypertension is one associated factor actually. So usually kidney disease, especially in the young and old, we diagnose it when the patient is having hypertension, and then we check for the renal function test, then we'll be diagnosing kidney disease. Actually, kidney disease the patient will get symptomatic in a chronic renal failure. It's only in the end stage only there will be symptoms. When the end stage comes, there may be sometimes the patient get a fever or something, then getting vomiting and all. Or along with it, usually it may precipitate if a severe disease or a food infection or a respiratory infection or something comes, and along with that there will be vomiting and very high urea and creatinine. Actually, the final stage is high urea and creatinine levels. It acts as a toxin to the brain and all. You start vomiting and all. But it is actually the disease is there for a long time only because of the trigger there is a sudden hike in the creatinine level and all. Usually, if 6 or 7 creatinine level also won't create much of the symptoms actually. Only when the creatinine level goes usually above 10 and all, around 10 and all, the really symptoms comes. If you want to find out a renal failure in the early stage or before damage, actually, before irreparable damage or irreversible stage, you had to do the renal function test, especially the GFR and the albumin. There will be the leaking of the protein, that is albumin, which is actually controlling the blood pressure. Blood pressure control and this albumin is an important factor. And also the kidney has a major part in the controlling of the blood pressure itself. So if the blood circulation in the kidney is affected, there is a hormone called renin. Renin is released from the kidney, and renin, angiotensin, aldosterone mechanism, that is a major pathway of control of blood pressure actually. Angiotensin is produced in the liver and aldosterone is produced in the adrenal gland. There are other hormones also from the adrenal gland which control the blood pressure, has an impact, that is adrenaline. We know that when you are excited or stressed or fight and or flight reaction, if you have in a critical situation, then the adrenaline comes out. That is actually increasing the BP. So if there is an imbalance in this mechanism, this adrenaline and noradrenaline release, also there can be hypertension. But the kidney directly is controlling through the renin-angiotensin mechanism. So most of the medications which is prescribed for the hypertension also is acting on these pathways, renin-angiotensin, either blocking the renin or the angiotensin or the aldosterone. Different types of, different category of medicines are there to act on different levels actually.
Actually, when you are talking about the kidney status, they say that if you have a chronic kidney failure situation, then it is highly likely that your liver will also be affected in some way. What is this relationship between this kidney function and the liver function?
Kidney and liver both are excretory organs. Liver have other functions also. Liver actually metabolize things, these toxins. Even whatever medicines you are taking, liver will metabolize it and make it in a water soluble format. Some may be in a other form, some will be excreted through the feces itself, through the bile. There is a secretion from the liver called bile, which is stored in the gallbladder, and then it is released in the intestine. It will be gone through the feces. The rest will be gone to the blood circulation. The detoxified liver try to detoxify whatever which is not nutrition uh, into a non-toxic level, and it will be sent to kidney for uh, excretion. So what kidney does, kidney filter from the blood, all these toxins are filtered and the tubules and thrown it out through the urine. So if the liver is damaged, the liver may not be able to detoxify all the things. So this toxins will be circulating in the blood. So it will be directly having an impact on the kidney also. So it can damage the kidney. Even if you are taking a medicine, and if the liver is damaged, if the liver is properly functioning, only 10 or 20% or even less than that will be reaching the general circulation and going to other organs and to the kidney also. But if the person is having a damaged liver or liver function is damaged problem, then if you are continuing taking that medicine, that large quantity of the medicine will get into the circulation and that will damage the kidney, and definitely other organs also get the impact, and both the kidney and liver. There are complications of the medicines, especially this some sort of some antibiotics, especially when you are taking 2, 3, 4 antibiotics together, like in TB and all. You may have to take a combination of antibiotic and also combination of medicine for the chemotherapy for the cancer. So it can directly impact the liver or the kidney, and both ways it can affect. So that is because both are acting in a similar way. And also if you are watching carefully, you can see that if a patient is having kidney disease or liver disease, their skin also will be affected. The third major excretory organ is the skin. So if you have a problem with the skin, you should definitely look for even this eczema, psoriasis, or just a discoloration. Then you should definitely look into the health of the liver and kidney, because that can be, it may be a reflection of the just a darkness or some patches or itching and all. It may be a manifestation because the from their skin, the waste is dumped to the skin, so it is creating itching or discoloration. So we should be always look if there is any skin disease or any problem with the skin. Definitely look for kidney function and also liver function.
Similarly, it is said that if the kidney function is affected, even the heart's health can be affected. What is the way in which this is to be understood?
See, if the kidney function is affected, if the kidney GFR is getting low, that means there is not enough circulation to the kidney. Definitely there will be BP hike will be there, unless you are taking a usually such patients will use the sartans, this renin angiotensin mechanisms blockers. There are so many type of medicines itself is there. If you are blocking the renin at some level, you may be getting a blood pressure control. But otherwise, the BP will be high. If the BP is high, but it will be very difficult for the kidney patients. It's the most difficult to control the BP is kidney patients. Most I have seen people are taking 3, 4, 5 medicines, but not controlling, not able to control BP, especially with the CKD, chronic renal failure patients. So this impact of this high BP is definitely have a impact on the heart, and invariably this high BP patients will be having high cholesterol and triglyceride also. So because it is all connected actually, kidney, liver, and all. The liver is the metabolic center. There will be some metabolic derailment will be there. So the cholesterol and triglycerides will be high, and there will be blocks in the so the excess fat in the blood, so it will be deposited in the blood, inside the blood vessels. So the blood vessels is getting narrowed, and the BP will be high, and it will be further aggravating the BP and the damage to the wear and tear of the blood vessels and the heart. So the chance of heart attack will be very high if the patient is having kidney disease. That is why even we usually what we are doing, what I'm seeing is also uh, uric acid is high, then immediately the people will start taking medication for the uric acid to reduce the uric acid like fluvoxamine and all. So actually, if you don't have gout, that is, a gout is an entirely different thing, that is precipitating this uric acid crystals inside the joints actually. But in many of the cases, the high uric acid is because of the either taking too much of protein and a high purine food, or because of the kidney problem. And if a person is not knowing that he is having a kidney problem, he is taking plenty of protein, high protein, uh, too much of food also, their creatine, this uric acid also will be high. So in fact, if such patients, without controlling the intake of this food, protein and other high purine food, if they are taking uric acid reduction tablets, uric acid will reduce, but the impact on the kidney will be very high. And because uric acid is also a waste product, and you are blocking the production of the waste product itself. So there is many studies shows that if you are taking medication for the uric acid for a long time, your chance for heart attack will be high. So that it also, those patients who are taking uric acid medicines should also know this, and they should, it is not, you should control the uric acid with adjustments in your food. You reduce your protein and high purine food, then see and reduce. Or if it is not reducing, you should check the other parameters of the renal function, especially GFR and the albumin or RBCs, leaking of RBCs in the urine. These all things gives idea about the kidney problem. If the kidney is damaged, if their GFR is started below 90, you should be very careful in taking medicine itself. Medicines will further damage the, because any medicine, it is it is actually making strain on the liver and also the kidney. And the kidney is damaged, the strain directly, the strain will be there in the liver, because the liver is producing detoxifying, and these toxins are remaining in the body. Then again it is the responsibility of the liver. So both will be, and definitely then the skin. So if you have any of this disease, if you have any symptoms on the skin, you should look for the kidney and the liver. And if you have a liver, fatty liver, or liver enzymes is high, you should check definitely the kidney function. And also if your kidney function is problem, then look for the liver, whether any fatty liver, or as a part of the treatment of the chronic kidney disease, you should make your health, you should take care of the liver also. If these organs are in a combined way, try to detoxify and excrete the waste material. So if one person is in a little weak, the other can, if the other are strengthened, that also can give health and keep you healthy.
Actually, it is heard that normally if this kidney function is found to be lacking, and there is some sort of kidney disease present, usually it is something like a wait and watch approach, do some improvements in health, and generally it's like that. and the solution is that when it is needed, we can think about dialysis, so that this problem is managed. In that sort of situation, people generally have a feeling that finally there is dialysis is always available, so there is a solution in case it comes to that. In your opinion, what is it that when a person initially realizes that he has chronic kidney disease, how should that person actually plan his future health?
See, if you pick up renal failure in the early stage, previously there was nothing to do. So doctors also won't say. Even the lab also will not give a proper report, because the range it is shown is zero point 0.6 to 1.2 is the creatinine level. So no one is giving GFR. We all know that the gold standard for the early finding of the kidney disease, GFR is the thing. But we never see such a report. Only nowadays we are started seeing it only. Actually, I was also, when I'm coming into this lifestyle correction, more clinically supported lifestyle correction, um, my understanding also was much limited, because the general understanding among the doctors is much limited. And now, if you are able to diagnose in the early stage, that is in the first level of renal failure, that is, if the GFR goes below 90, or there is albumin or urine, any other symptoms, that itself is the second level. If the GFR is started down, definitely it is the second level of renal failure. And if before that itself there can be urine in RBCs in the urine, or albumin in the urine, that is called the first level of the kidney function, kidney damage. If that level, if you're getting, there is no medicine. You should understand that. But with the lifestyle correction, you will be able to maintain the kidney health, not to go down. And you should be very careful in taking food, and there may be intolerant food, and also the color, preservatives, junk food, all these so many sauces and all these things. Actually, now we are not taking fresh food, or not simple food. You are adding so many sauce will be containing so many chemicals inside that. And so so much of manipulation is happening in the food. It is all chemically chemical, so many things. So it all have an impact on the kidney. If you are diagnosing this in the stage CKD in the stage 1, stage 2, then it will be easy. The stage 2 means the GFR is not gone below 60, above 60. Then you don't have to do much of the nutritional adjustment. If you are going below 60 GFR, then you have to restrict the protein. For the lifestyle correction or lifestyle modulation for correcting any or reversing any disease is actually by through the food and exercise. But you won't be able to get the full nutrition. Your protein has to be reduced. But if your GFR is below 60, and if your GFR is below 30, there is a risk of potassium increasing also. And then you have to restrict the potassium also. If your GFR is below 15, that is stage 5, the end stage actually. In that stage, even water content may be reduced. Usually, water excretion capacity, most of the patients, what I'm saying is, will not be much affected if the till usual. Generally, if the creatinine goes above 8 and all 8, 9, then the urine capacity, this production of urine, that water excretion also will be affected. But if you are finding out in the early stages, no, you will be able to give doctor who's basically, if I am treating the patient, I can, if the patient is above GFR is above 60, it is easy for me to reverse, and it usually we will be able to bring up the GFR above 90 itself. Is a diabetic and hypertensive patient, it is very easy because they'll be having so many diabetic and hypertension medicine. That workload is over. With the diabetic medicine, we can be, if it's a type 2 diabetic patient, diabetic medicine can be stopped in the first day itself. So the patient is getting free from the diabetes medicine, and the kidney or liver is happy. They don't have to work on that. And the BP medicine also, it is easy to control the BP because we can adjust the potassium. You don't have to restrict the potassium intake in the food. So you can give the correct sodium potassium ratio, then the BP can be easily corrected. Within 1 or 2 weeks, the BP medicine also can be withdrawn. So with the usually diabetic medicine, we can stop abruptly and see the blood sugar is okay. Within 24 hours, usually the blood sugar will be okay. With this my mode of clinically supported lifestyle correction, in which special food without color, preservatives and all, but it is ensuring that all the nutrition is there. So such a diet will control the sugar definitely, because low calorie, low carb, your sugar will be controlled. Otherwise, you should have so much of tension. If the stress level increases, there is a problem. But if you don't have any much stress also, it is easy to control actually blood sugar. Then the BP also, the same way, within a month, if you are taking 4 or 5 medicines also, most probably you will be able to reduce the medicines, BP medicine also. Sometimes when they become stressed up and all, they may need a low dose, if 1-2 tablets for the this stress. Different medicines of the BP is acting on different levels. There are some medicines is for the reducing the stress type of, that is beta blocker sort of thing, can be given if the patient is getting BP on the stressed, when they are stressed, in that situation only. So that way we will be able to, most of the patient, even with the renal failure 5 stage also, diabetic medicine can be reduced and get a good diabetic control without the medicine, and also the BP medicine, at least reduced to SOS level. That is the situation. So that will give a lot of relief for the patient. And then the repair possibility, but when it is stage 5, the repair is limited. Stage 4, it is much better. And if the stage 4, you may be able to bring it up to stage 3. And in the stage 3, you will be able to bring it up to stage 2. And if it's in stage 2, most probably you can go up to normal level itself.
Generally, those who are diagnosed with chronic kidney disease, they have to be usually taking lot of medications for lot of comorbidities that they may have, like diabetes, hypertension, and so on and so forth. So, in this context, what is understood but not discussed normally is that all these medications actually add to the chronic kidney disease problem. But it is felt that nothing. There's no point in discussing it. So, what is your understanding about in such a situation? What should the patient and the patient's support system understand about this?
See, now for the last 75 to 100 years, actually you are giving so much hope and dependence on the modern medicines, is pharmaceutical medicines actually. So, but with the last 50 years, we are very clear that it is not actually really not doing much. And the chronic diseases like lifestyle diseases, modern medicine made wonders in treating infectious disease. Vaccines and antibiotics has given wonders. And also the trauma care. If you have a wound or broken bones, definitely it is very helpful. And anesthesia and the painkillers has definitely reduce the suffering of the human being, and also the pets and other animals too. But for the lifestyle diseases, it is very clear that it doesn't have much role, because if you are diabetic, you have to take your lifelong medicines. Only thing, you can add on number of medicines. It is, you cannot reverse the disease. And for the hypertension also, there is no, you cannot relieve hypertension with the medicine. You can add on medicine when it is not responding, when a medicine is started. It will work for some time, and after that the BP won't be under control, then you are adding like that. So the whole impact on this medication, actually when the medicine body considers all these medicines, even the antibiotics, the helpful thing, they usually, generally body, it is antibiotic against our system also, but it is more sensitive to bacteria. In a way, we are making it more sensitive to certain type of bacteria. That is why we are getting a relief. But it can also damage our system. That's why when sometimes we get the adverse effect or side effects, and kidney damage, liver damage, all sort of things can happen. But we are, because of our dependence on these medicines, actually we are eating medicine every day. So diabetic patient, 3-4 medicines and an insulin injection also. And I along with definitely a patient who is diabetic will be, after some time they will become hypertensive also, because this when you are taking medication for the diabetes, you are increasing the insulin level, either by medicine or by insulin injection itself. Insulin actually produces sodium retention. Sodium is something, everyone knows that sodium has to be reduced in the food in hypertensive patients. But insulin actually try to retain the sodium as much as possible. So that itself is actually increasing the BP. That is the reason for a patient when started, initially there was only diabetes, but after starting medication for the diabetes, they get hypertension also. For that also they start medicine. And after that they will get usually fatty liver, or the cholesterol will start, or triglycerides start hiking. And after that they get a heart attack, or chest pain, and when you look into, there is block and you put a stent, and after putting stent you again give 1 or 2 medicines also, this breathiness. So you are adding on medicines, and the impact on the liver and the kidney, it is too high on this, because their workload is increasing. Again, already they are sick and their workload is increasing, so finally they fail. So what is the solution actually? It is very clear. Even the Hippocrates has said 2400 years back, is the safest way to health is all the correct amount of nutrition, not too much or not too little, and correct amount of exercise also. That is also too much, not too much or too little. So with that, that is the real solution for the health actually, and that is really working. But previously we were not knowing what is actually the correct nutrition, what all nutrients are needed, and which food it is there and things. But now we have very clear idea what all nutrition and how much quantity is needed. So what are the muscles and what are the correct exercises? All these things we know. Only thing, how to implement that is the difficulty. So basically in this clinically supported lifestyle correction, what I am trying to do is also the same thing. Give correct nutrition for the patient. Is more now our problem is basically, major problem is obesity. So calorie restriction, if the patient has to come out of the reverse the diabetes or hypertension, whatever is, if the patient has excess fat in the body, it has to be reduced. So it should be a low calorie food, but it should give all the nutrition for the body. And also correct exercise. The patients are patient, they cannot do hectic work, they cannot go and work out in when arthritis, renal failure, diabetic patients with this all sort of sickness, they cannot go make you work out and in the gym and things. So gentle exercise which a patient also can do. Such a simple exercise and this correct nutrition, and it can do wonders actually. So I am actually in the most common cause for the renal failure is the diabetes. And diabetes, the first day itself we can type 2 diabetes. That is the most common disease which is actually creating most of the renal failures. If you go to a dialysis center, almost 90% of the patients, the cause of renal failure is either diabetes or hypertension or both. Only a few, less than 10% will be having these other problems like autoimmune disease, SLE, this IgA nephropathy and all. So these all can be preventable. It's the most difficult is actually this autoimmune disease. That also, if you diagnose it early, then you will be able to prevent a renal failure and things. But if you depend on medicine, you may not be able to say. Sometimes you may be able to delay a little. For example, actually one patient who is diagnosed with SLE 14 years back, and she came for treatment for this clinically supported lifestyle correction. And actually after 4 months back, her creatinine was only 3. Diagnosed when she diagnosed with SLE, there was no kidney failure at all. But 4 months it was only creatinine was 3, and now creatinine is 7 or 8, 7 something. So she's in real renal failure within 4 months. Then usually I send for a kidney. They were asking, and I told them, we will see what is the status of the kidney, whether it's shrunken or that will give. Some patients the kidney may not be shrunken. In that case, it will be reversal is more easier. But the patient, when they came after the scanning report, she was very worried. The doctor to scanning asked her whether you are not taking the treatment till now. Are you taking any treatment? She was felt very bad. She was taking treatment from the beginning itself. She's on heavy dose of immunosuppressants also, Celseptin and other HCQ, and these SLE patients will be having arthritis also. So HCQ, so many medicines actually. Now she is in renal failure. But I have asked her, why you didn't came for this clinically this support medicine, supported lifestyle correction when you are at least when the creatinine is 3. She was aware of this clinically supported lifestyle correction, and she's seen the videos also. But I asked her why she didn't. Then I didn't have much problem, but I am taking medicine. And she was actually not in Kerala. She's staying in abroad actually. So she is not given much important. But now when it is 7 and 8, she came to Kerala for the treatment. And all the nephrologist and all, they have, again, she knows that already this sort of lifestyle correction treatment is there. But she again met so many nephrologists and all. Then only she's coming. So now the end stage actually. So what we can try is, but the problem is here the correct nutrition and correct exercise. Exercise also will be, we cannot do the further because the kidney is affected. No, when you are doing more exercise, the creatinine level can go high. So the exercise also will be limited, and also because now the creatinine for stage 5, potassium has to be controlled, protein has to be controlled. So you cannot give proper nutrition for the repair itself. So what I want to tell this, understand the people has to understand. You should definitely, now the facilities are there. If you check for your kidney function, and if it is starting reducing, even if your creatinine is even around 1, that means your already renal problems is started. If you take care in that stage, you can prevent a renal failure. So prevent failure to go into stage, even if you detect in the stage 1 itself, you can keep your kidney as pristine, or not in that stage, in the non renal failure stage, you can reverse it. The reversal, you should understand, basically the people has to understand, is for any lifestyle disease, any organ failure, the medicine is not the answer. Only thing is you can keep you healthy only by adjusting your lifestyle according to your genetics. Even for the people with this polycystic ovary disease, it's a familiar, ovary, is polycystic kidney disease. Polycystic kidney disease, it's a familial tendency is there. If you are diagnosing with a scan and you see multiple cysts in your kidney, even there also you can prevent the progression by preventing, avoiding this all the toxic food like color preservatives and the cosmetics. It's all giving an impact on your kidney. So avoid that. Keep your avoid obesity or excess fat in the body. Then even when the polycystic kidney, the renal failure progression will be reduced actually. So even you won't be able to reverse all the cysts in the kidney and all, but you can avoid progression of the disease by keeping healthy food and healthy exercise and keeping a healthy body composition. Only thing you should know how to use. None of the nephrologists will be able to help you in that. Nephrologist is basically can give, when the organ is totally failed, you can, they will give you, can do the dialysis, and when the phosphate is increasing, some phosphate binders can be given, or the bicarbonate is reducing, some this sodium bicarbonate can be given, or what else, or some some special is nutraceutical protein that doesn't have any non-benefit or proved benefit. Some nutraceutical product like some preparations are there. Such things can be given, and the BP medicine or potassium binders or the BP medicines, or give all the other accessory these comorbidities like diabetes, hypertension, etc. can be treated. But that is the only possibility with the medication. But the real your possibility is lies in the lifestyle correction. But you should be willing for that. That is the thing. There are people, I have seen people who's already in the renal failure and ask for dialysis, but then also they are not willing for a lifestyle correction. They just want to free this thing. And they're asking if dialysis, whether I can take whatever I want. Even you're on dialysis also, you can take whatever you want. You had to cut the potassium, you had to leach the food you take, and you had to cut the protein, and even you had to reduce the fruits and all. You cannot take, even that is the so much of restriction. If you look into the net itself, you can see what are the restrictions you had to. But even kidney dialysis, or that is actually a little time, 2 hours. It's a artificial kidney you are renting for 2 hours or 1.5 hours or 2 hours in a week. So it don't give all the functions of the kidney. So you had to what if you have a problem, if it's related to lifestyle, you should be willing and you should make up your mind for that.
Actually, nowadays, what happens is those who are having this chronic kidney disease, they will also be sometimes suffering from other major disorders. So, invariably, in diagnosis, for diagnostic purposes, scanning is very much used. And for scanning, also to get a better picture about the status of the patient, it is dyes are used for scanning. And we hear that the usage of dyes, especially when the patients have chronic kidney disease, is very associated with a high risk. So, what should a patient know when they have to decide on going for a dye-based scan?
This radiopaque dye is used for many procedures actually, diagnostic and the operative procedures. Diagnostic for the CT scan, MRI scan, and all, to get a clear vision, clear pictures. Doctors, radiologists use dye. And also, this interventional cardiologist, those who are doing the angiogram, and for the even now multiple angiograms are done, no? For the heart or the brain or the leg, if there is a vasculopathy is there. So in that also the dye is injected. So a person who needs such a procedure, especially this angiogram and angioplasty and all, definitely the kidney will be affected, because kidney, the problem is with the blood vessels. Heart, the problem is with the blood vessels. The heart blood vessels is affected, definitely the kidney blood vessels also will be affected. So check for the creatinine first. But generally doctors, even if the only if in the fifth phase, the doctors will say generally. The cardiologist, the problem now is the cardiologist is dealing with the heart, kidney patient disease, kidney nephrologist deals with the kidney, and usually if it is not in the renal failure stage 5, if the creatinine level is above or GFR is above 20 or 15, usually nowadays it's a renal failure. So they will go for this injection and stenting and all the procedure. And that will actually immediately, you can check, most of the patients goes into renal failure after such procedures. Already the kidney is compromised and doing that. Actually, in my experience, I'm seeing patients who's come when they're TMT positive, they're asked for an angiogram, they are coming, and or someone who's undergone an angiogram, but they are not able to put the stent that time. They want a second sitting for a stent, or only put one stent and put more phased stenting is needed, or a stent cannot be applied and a bypass is needed, or already 3-4 cents is stent is put, and now we cannot put more stents, so go for bypass. And there are people I have seen who has put for 3, 4, or 5 stents and also bypass, but now also they are in pain, angina problem. See, at any of this stage, actually, if you are willing for a correction, you don't have to go for the further procedures. You can reverse it from that stage itself. Only need is your willingness for the lifestyle correction. And all these patients, usually, if there is a real problem for the heart, there will be real problem for the kidney also. If you inject this dye, the renal, you may not go into renal failure, but it can be, if the renal function will go down. Like if the even the patients who is having creatinine was 1, but after the uh, angiogram or angioplasty, it may go to 1.4 or 1.7. But if the kidney creatinine is 1.7, it may go to creatinine level 3 or 4 or 5. It depends if you are allergic or there is a problem. Everyone will not be getting the impact in the same way. It may be in the different way. But one thing is you should understand that if you are willing for the correction with the lifestyle correction, you don't have to go for a angiogram or angioplasty or bypass at all. You can reverse it, and I had seen the patient who were I had treated actually. They have undergone this lifestyle modulation treatment. Those have troponin very high, already having an attack, and such patients also it is will be gradually reduced, and invariably these patients will be hypertensive or diabetic and all. Those all these things can be reversed, and they can be come out of all the medication within a month itself. Only thing, if they have put already, there are people who has put already one stent and a phased stent and sort of things. Those patients has to continue the blood thinness, this aspirin, clopidogrel, Relinda sort of things for another 1 year, or at least 6 to 9 months they have to take 2, and after that it can be reduced to 1, and the 1 year they have to continue. That is for the safety, not for the heart safety. That is only because they have put a stent. If you put a stent, your chance for getting the clot on the stent is high. To prevent that, you are giving this blood thinners. But you are taking another risk. If you are meeting an accident or a wound, or if you need an emergency operation, then this blood clotting mechanism is a problem. So then you have a problem also with that. So it is always better for the lifestyle disease, better you correct the lifestyle. That is the real science. Correct it scientifically or logically. Lifestyle disease, correcting the lifestyle is the answer, not the medication. Medication you cannot reverse, only you can symptomatically correct it. So immediately after, if you get diagnosing a high BP, definitely you need to take medication for the time being, then you correct it. So immediate care, modern medicine, this medication, interventions and all is very good. But for the long term, or for other things, it can create problem. So basically understand that lifestyle disease, lifestyle oriented, the answer lies in the lifestyle correction itself.
With this, we come to the end of today's program. We have understood that as far as chronic kidney disease is concerned, the earlier we realize that we have it, the better, and most importantly, understand that correcting one's own lifestyle is the real factor that can help in reversing the condition. And the most important thing is not to wait for things to get worse, expecting that there is always a solution at the end of the tunnel. So always early action and taking over personally or individually remedial measures to improve health is the way forward in the future. Thank you.